Mr. Giese, it's our great pleasure to have Carol Rowan West as our speaker today. She's the Director of the Office and Research Standards since 1985 of the Massachusetts Department of Environmental Protection in Boston. She's also Director of the Division of Environmental Analysis, the Senator William Hall Experimental Station. I'm just going to give you some buzzwords to kind of give you a perspective on her experience. Chair, Interagency Coordinating Committee, Chair, Advisory Committee, Health Effects, Chair, Fish Toxics Monitoring and Assessment, Chair, Emerging Contaminant Workshop, Chair, Nanotechnology Committee, Direct Research, Priority Toxics such as mercury, experience at the endocrine unit, working with pancreatic cancer cells, early immunoassays in Mass General Hospital. He has an MS in Environmental Health from the University of Massachusetts, and she studied in toxicology at Northeastern University until all of a sudden she got engaged. She got an opportunity to offer as a directorship. Her advisor went to another university, and she says, "Okay, let me hit the real world at this stage here." So, you know, real smart move. A tough university, external advisory committee, and she's testified before the Senate on Perchlorate and TCE. So she has a tremendous wealth of experience, so we're really delighted to have her talk. Her talk is Considering Early Life Stage Sensitivities and Setting Environmental Standards, the Perchlorate Case. Carol.
Thank you. Okay, thank you, Dr. Giese. Good morning, everybody. Thank you for the invitation to do this webinar today. I have to admit it's the first one I've done, so fingers crossed that the technology works okay. And I'm also very pleased to be here today to tell you about the work of the Massachusetts Department of Environmental Protection, and call it Mass DEP. In my presentation today, I am going to cover the mission of the department, the responsibilities of the Office of Research and Standards. I thought the best way to portray for you the work that we do in the department is to have an actual case study presented. And so I chose our work to set a drinking water standard for the chemical called perchlorate. SDEP is responsible for ensuring clean air, water, safe management of toxics, recycling of waste, timely cleanup of toxics and radionuclide material at hazardous waste sites and at spills, and the preservation of wetlands and coastal resources. Now, the projects that we undertake at DEP involve project teams where different members bring different expertise to the project, whether it's engineering, toxicology, risk assessment, hydrogeology, monitoring specialty, chemistry, even policymakers and lawyers to make sure that we're working within our state and federal authorities. We have a statewide focus in terms of how we're organized. Boston is headquarters, where the main focus there is the development of regulations, programs, and policies. And we have 4 regional offices in the Northeast, the Southeast, around Worcester and Springfield. And at those offices, that's where the staff go out and they work with assigned communities. There are potential or real environmental issues, and they go through all the steps to ensure cleanup of waste and that public health is protected. In terms of the Office of Research and Standards, it was created in 1980, and we provide technical support on the health effects of chemicals that are found in the environment, and mainly set standards and guidelines for protecting the public health from chemicals present in air, water, and soil. The office was established because of the fact that the U.S. Environmental Protection Agency, that has responsibility for the whole country, doesn't often address the chemicals that we're finding in Massachusetts. Massachusetts. So the office was set up to do just that. And I just thought it was interesting to note that not many states have a group like the Office of Research and Standards. It is mainly just a few other states, maybe a handful, that do this kind of work. And so we have 11 people on board, and they specialize in toxicology, standard setting, both human health and ecological risk assessment, environmental health, chemistry, and statistics. We work outside of Massachusetts borders, for example, with the other New England states on air, water, and waste issues. That's pretty easy for us to do compared to states out west because we're so geographically near to each other. And then the governors in New England also identify environmental problems that they want to address. We work collaboratively on those issues. At national level, we work with a group called the National Council of States, and virtually every state in the country participates to talk about environmental issues that either the states can address because EPA is not, or we address and maybe give EPA some insight about how it can be done. We work with the U.S. Environmental Protection Agency as well. And then we work on an international level. We have a lot of work on mercury ongoing with the Eastern Canadian Premiers, and we have issues on toxics with both the United Nations and NAFTA. Okay, sort of covers what I'd like to say as an overview about the department, and I would like to get into the case study on perchlorate. First, for the background, which is what is perchlorate, why are we concerned about it, and what we had to do. Regulatory activities cover regulations with respect to protecting drinking water as well as waste site cleanup. And this project involved all the regional offices as well as headquarters in the department. Finding pollution sources for perchlorate based on our testing, and then our conclusions. Perchlorate is an anion consisting of chlorine and 4 oxygen molecules. It's a strong oxidizing chemical. It's soluble in water. For example, if you spill perchlorate on the soil, it will, through rainwater, percolate through the soil readily and contaminate groundwater. And it's very stable for up to decades when it hits groundwater. A person ingests perchlorate, it's well absorbed into the bloodstream, and have determined that bathing and showering with perchlorate in water is okay because it's not dermally absorbed through the skin, and it's not a volatile. So if you're taking a shower, you will not be breathing that chemical. The most familiar uses of perchlorate are rocket fuels and a massive amount of various military weapons. The Department of Defense and NASA are big users of perchlorate, and they are the two agencies that are very much responsible for the extensive perchlorate contamination across the United States. It's somewhere between 30 and 35 states that have groundwater and drinking water contaminated with perchlorate, as well as hazardous waste sites with perchlorate. Got involved in perchlorate back in the late 1990s because the Massachusetts Military Reservation, or MMR, a military base on Cape Cod, was to have up to 600 parts per billion of perchlorate in the groundwater. And geological engineers put what's called sentry wells to determine where the plumes of perchlorate are moving. And in early 2002, the sentry wells around the town of Bourne and their public wells started getting hits of perchlorate. So we knew what time it was going to hit the public wells. And in March 2002, the town of Bourne closed 3 of their 4 wells because of perchlorate contamination. At that time, in terms of providing water to the community, wasn't a problem because the Cape has a cooperative with water sharing. But in the summer, with the tourist season expected on the Cape, it would be a big problem with not having sufficient water quantity. So the water district contacted DEP and requested that we set a drinking water guideline for perchlorate so they would know whether or not the water could be used. The Office of Research and Standards used the most current scientific information, mainly that developed by the U.S. Environmental Protection Agency, who has been taking a lead on perchlorate, and we made a recommendation that the public should not drink perchlorate if the level in water is greater than 1 part per billion. The EPA had been working and taking the lead for the country on perchlorate, and it was a national concern, but their work was held up by the White House because the Department of Defense and NASA took great exception with EPA's work, saying that the levels were too low and EPA was being overly protective, and it was going to cost them too much to clean up and jeopardize their programs. So a decision was made to have the National Academy of Science establish a National Research Council committee to evaluate EPA's work, and that was going to take a couple of years. So in 2003, Mass DEP made a decision that we would set standards for chlorate that would involve not only drinking water, but also standards to clean up waste sites, which would include water and soil as well. I want to acknowledge the other staff in the Office of Research and Standards who worked on this project, and also established a Science Advisory Committee on perchlorate, and these are the individuals who helped us in our work. The way it worked was that the Office of Research and Standards would review the health effects information and write a report, and then the advisory committee would review it and give us comments, and we would, take into account their comments and move forward with our work. In terms of setting a drinking water standard, the first step is to review all of the published studies, and they consist of clinical studies conducted in humans, laboratory animal studies, as well as population exposed studies or epidemiological studies. And then the concept on an approach for setting a drinking water standard is you're looking through all that literature and trying to find a dose with adverse health effect, or the lowest dose with adverse health effect. Then the protocol is that we apply uncertainty factors for data gaps. We take account other sources of exposure to the chemical, and then we extrapolate that end dose to a level in drinking water that would be protective of public health. Now, I'm going to spend a few minutes talking about uncertainty factors. There's a protocol that has been developed by EPA and followed by EPA and any of the states that do set drinking water limits. And there are 5 categories of uncertainty factors, such as if you have a healthy population and you want to consider susceptible subgroups, if you're working with animal data and you want to consider humans. And so standard factors that are applied. Okay, let's talk for a few minutes about the hypothalamus pituitary thyroid axis. And it's here, the hypothalamus in the brain. This is getting to the mechanism of toxicity of perchlorate, releases thyroid releasing hormone, and that stimulates the pituitary to release thyroid stimulating hormone. And then that directs or signals the thyroid gland to use iodide that's stored in the gland to make thyroid hormones called T3 and T4. Those are released into the blood. And those are very, very important hormones. They're responsible for proper growth and development, especially development of the brain, and maintain metabolism. Now, the feedback loop where the brain can identify if the levels of T3 and T4 are too low to support development, for example, more will be made. Just a different slide to give you a different look at what's going on within the thyroid. And the key to focus on is the NIS, or the sodium iodide symporter. That's responsible for bringing iodide into the thyroid follicle and then into the thyroid colloid, where thyroid hormones are synthesized. Thyroid hormones are then transported back into the bloodstream, and it's mainly T4 that's synthesized in the thyroid gland, and then as T4 is dispersed within the bloodstream, enzymes convert to T3. Now, what chlorate does is it has a greater affinity for the NAS right here, so preferentially gets into the thyroid gland rather than iodide. What happens is the thyroid hormones are not made, and that's a serious problem, which I'll discuss further. Now, here are some very important exposure considerations. On the left, we have a pregnant woman who's healthy, and the arrows depict that making the proper amount of thyroid hormone that's needed to cross the placenta and get to the developing fetus. Now, thyroid hormone is very important, especially in the first 12 weeks of life, because the fetus does not have a thyroid hormone. And after 12 weeks, the fetus can start making thyroid hormone, but never more than a one-day supply. And the thyroid hormone, again, it's needed for brain development. Now, a woman is exposed to perchlorate, which is shown on the right side. You can see that the thyroid hormone levels have decreased, and it's possible that the fetus is not getting sufficient amount of thyroid hormone, which could result in brain effects. But also a second insult. Perchlorate can cross the placenta, and the fetus can be directly exposed. So even if the fetus were able to make some small amount of thyroid hormone, that's inhibited, and it can result in irreversible brain damage. Now, in terms of the breastfeeding infant, the breastfeeding infant takes in iodide from the breast milk and uses it to make thyroid hormone. But they can only make a limited supply, again, no more than a day. When a woman is exposed to perchlorate, the perchlorate is excreted into the breast milk, and the infant is directly exposed to perchlorate, which can inhibit the thyroid hormone development. And what also happens is perchlorate inhibits the iodide from reaching the breast milk, so again, it's an insult to the developing infant. So in terms of physiological roles, the thyroid function is very critical to normal growth and development. They have studies nationwide, worldwide, that show that when women do not have sufficient iodide in their diet, that their offspring are born with neurotoxic diseases, such as lower IQ. It could be from 7 to 13 points, as well as speech impairments and movement impairments, and these are irreversible effects. So, if you had some of this information and you were going to approach setting a drinking water standard for perchlorate, you have to ask yourself, well, what are my data sources? And preferably would like to have human studies that could be used, but that's not always the case. And we have to rely on controlled animal studies conducted in laboratories. Then, depending on what data we have, key issues that have to be considered, and I'll discuss these as we go along, but issues such as what is adverse health effect, have a healthy human, how do I extrapolate to a more sensitive birth, such as a fetus, such as those. And then process elements. When you work for the Department of Environmental Protection, we can't work in a vacuum and set a drinking water standard. We have to have a very public process. So as I told you, we had an advisory committee on health effects, but we had to do a lot of outreach to water suppliers, to the boards of health, about what is this issue and why we need to work on it, We had, at their request, toxicologists from the Department of Defense, the Navy, Army, and the U.S. Air Force come to give us their interpretation of the toxicity of perchlorate. And when we had our proposal for drinking water and cleanup standards, we took that out for hearing so that the public could give us their feedback, and we were required to take that into account before we made a decision. So with respect to the Toxicity Database for perchlorate, there are numerous animal studies, epidemiological studies in workers, and those based on population and environmental exposures, and controlled clinical studies. The clinical studies are mainly in healthy adults, with the exceptions of individuals who had Graves' disease. And back in the 50s and the 60s, individuals with Graves' disease are making too much thyroid hormone, and so doctors would give them doses of perchlorate to reduce the thyroid hormone, and that was done until people learned that that resulted in the development of aplastic anemia. That was stopped. Okay, with respect to issues with setting perchlorate drinking standard and reviewing the toxicity studies, there are several issues that we had to address. First of all, many of the human studies were based on very small study sizes of people, so the statistical power to identify an effect was low. The other thing that we found was that when you expose people to perchlorate, there was a huge variation in the response to perchlorate. We lost if you averaged the response at a particular dose. We were very focused on trying to find studies that were short-term duration because of, for example, exposure to fetus and infants where there were just windows of time where they were very vulnerable, as chronic studies to represent a lifetime of exposure. And there were a lot of issues and controversy about benefits of the human data versus the animal data for use. And what we did was we preferentially used the human data, but also used the animal data to support our work that our human data were accurate and representative. Okay, and there are policy issues that we faced, and I'll get into these. What is an adverse health effect? We had instances where we didn't have an adequate database and somebody rendered a professional opinion based on maybe clinician's opinion, for example. And how do we protect the fetus based on healthy adults? This slide shows you the mode of action for perchlorate toxicity. We have the exposure that takes place, and then there's an internal in the blood. It goes on to reaching a biologically effective dose to cause iodide uptake inhibition into the thyroid gland, which then results in an early biological effect, reduced thyroid hormones T3, T4, and then an increase in TSH. Children were concerned about altered development of the brain and birth effects, and then for adults, thyroid hypoplasia, and there have been some studies that show that that could result in tumors, so that would be for adult human health risk. Now, all along, when you're looking at data and trying to fit doses into these various effect levels where you have exposure, we also have to consider the most sensitive members of the population. Now, we can use an example that of Research and Standards and our advisory committee wanted to focus on iodide uptake inhibition as the critical effect, because if we could protect against that as a dangerous impact, we're protecting against all of the other downstream effects. The National Research Council that perchlorate that iodide uptake inhibition until it reached 75% inhibition was not a problem, and so based on the studies we had, they called those doses a no effect level, and we were calling them a low effect level, and that has implications which I'll show you in the first slide. Okay, so our sensitive subgroups are pregnant and nursing women, the fetus, infants and young children. We have to the age 18 where the brain is still developing, and individuals with hypothyroidism who are not making sufficient thyroid hormone. The rest of the population, we're not susceptible to that extent because our thyroid glands hold several months' supply of iodide and thyroid hormone. We don't have any brain development going on. If you're exposed to perchlorate and there is iodine uptake inhibition, it's reversed once the exposure is stopped, and then perchlorate is readily excreted from the body in 8 to 20 hours. In terms of this, the next few slides are going to focus on how we set a drinking water standard for perchlorate. The first step is to estimate a reference dose, and that's a health-based dose, and it's an estimate of an oral daily exposure that is likely to be without adverse health effect, considering a lifetime of exposure. Once we have a reference dose, we have standard protocols for setting a drinking water standard, considering other factors. To set a reference dose, look at what's called the point of departure, and that's what I was talking about, where you look at all of your toxicity data and you try to find the no observed adverse effect level. If you have that, you look for the lowest observed adverse effect level. And then another technique developed by EPA is called the benchmark dose approach, where they take all of the dose response curves for perchlorate and they combine them in a computerized model to try to identify the lowest effects. And what that means, response rates at either a 5 or 10% rate. And we in our advisory committee did not want to use the benchmark dose approach because we didn't think a 5 and a 10% response rate was protecting public health. Once you have your point of departure, you divide by the uncertainty factors that are relevant. Your question?
The uncertainty factor, I'm assuming they're all greater than 1.
Yes.
Okay.
They generally are 3 or 10. Yes. So, I can go through the animal studies, so I'm going to focus on the human study that we and others used for setting the reference dose. And the previous study was a clinical study where 37 adults ingested perchlorate over 14 days, and iodide uptake was measured, as well as some serum hormone measurements after 1 and 14 days of exposure, and then 14 days after the exposure ceased. And there were 3 dose groups. And this slide I put in because I wanted to show you at the baseline 0. This is the y-axis is iodide uptake compared to baseline. And as you can see, in terms of baseline, there's a wide variability in the amount of iodide that's taken up into the thyroid gland, ranging everywhere from about 0.5 to greater than 1.5. Now, the lowest dose group, which is the first set of red dots on the graph, that particular dose group had only 7 individuals. And that was a problem because it lacked statistical power to identify any adverse health effects. And we did some calculations based on that data and estimate that using the small number of people, you'd have to have over a 40% change in iodide uptake at the lowest dose tested. And at the next dose tested, as well as the first dose, you can see again there's a variation in the individual's response to perchlorate exposure. And we were concerned, for example, with the 4 or more people here who had a much greater inhibition of uptake of iodide and how they would represent the rest of the population. And so we called this lowest dose in the Greer study what's called minimal low adverse effect limit, whereas again the National Research Council called it a no effect level. So in terms of uncertainties, I mentioned that the statistical power of the Greer study was weak. It was based on healthy adults. It did not address the sensitive subpopulations. And going outside the Greer study to the entire database, there was just a lot of questions we had. For example, when a pregnant woman drinks perchlorate in drinking water, what is that dose that gets to the fetus, or that dose that gets into breast milk? And there's no data on that whatsoever. So that's where we might apply a data uncertainty factor for database uncertainties. So in working with our advisory committee, we came up with a total uncertainty factor for 100 to apply to our lowest observed adverse effect limit. One member of our committee thought it could be 300, was more concerned. Another thought it would be 30, but we settled on the 100 and recognized that there were some differences of opinion. So this is math. We took our minimal low observed adverse effect limit and divided it by 100, and our reference dose is 0.07 micrograms per kilogram per day. In comparing RFDs, the National Research Council set a reference dose at 0.7, which was adopted by US EPA. California came out at 0.5. They used the benchmark dose approach, and here we are at 0.07. I must say that it was highly controversial, with the industry saying that we were overly protective and that we should make our reference dose higher. But we reviewed the NRC report, and we thought that their work was that basically would interpret our work, the studies, differently than they did, and we said we'd continue with this reference dose, and we were fortunate that the administration supported us. Okay, this is just a conceptual picture to how you set a drinking water guideline. You have your no effect level or the lowest observed adverse effect limit. You apply the uncertainty factors, and you have to account for is this population being exposed to perchlorate from other sources. Fortunately, perchlorate is pervasive in our food supply. When water that is used for irrigation has perchlorate in it, and this happens in California, the food takes the perchlorate up into the food chain, whether it's vegetables or grapes, milk, is quite perchlorate in our diet. So our analysis, we said, okay, out of what we think is the reference dose or the allowable safe dose, we're going to allow 20% of that to come from drinking water and 80% to come from other sources. California, that they thought 40% was the right amount to come from drinking water and 60% to come from food. EPA just allowed 100% of the exposure to come from drinking water. Our guidance from the Office of Research and Standards with our advisory committee is that sensitive subgroups should not consume water with perchlorate levels above 1. The rest of the population can consume up to 18 parts per billion, and bathing and showering are okay. Now we will switch over into what's required in setting a drinking water standard. The step is that we have to test all of the public water supplies in the state. To do that, we put out emergency regulations requiring every water supplier to test surface water twice a year and groundwater 4 times a year, and provide us with that data, because we need to know the extent of contamination in terms of how many public water supplies are impacted and at what levels. We have to decide what level we test to, and we were able to come up with a methodology that wasn't available to EPA to detect perchlorate reliably down to 1 part per billion. And that to look into how to remove and treat water that has perchlorate in it, and what are the costs. And all those things are factored in, as well as the health risk and what is the final drinking water standard. So our first round of testing, and we found 9 public water supplies, interestingly, all in the Cape with perchlorate. And we found that none of these were associated with military sites. So our Bureau of Waste Site Cleanup went out and they had to backtrack from the wells to find what are the sources. We found some unique, never seen before, sources of perchlorate. First of all, fireworks. We can't get a handle, the information won't be given to us about how much perchlorate is in fireworks, but they put in because it makes redder and bluer. And if you remember when you see the fireworks, you see this dot and then a huge boom, that's perchlorate. Blasting agents. Some blasting agents, not all, they're used in deep bedrock where it's very wet. They use perchlorate because it is so explosive. Then we also found that when water suppliers disinfect drinking water to prevent pathogen exposure, some of the hypochlorite solutions break down to perchlorate. We found a medical facility that was making stents and used perchlorate and was discharging a lot of perchlorate into the sewer system. I'm going to show you a few examples of the work. Here's Chesterfield, Mass., and here's our public water supply in the Davenport building, above 1 part per billion or 1 microgram per liter. This was a town office building, but unfortunately it also had a daycare center. After looking around and putting in groundwater wells, they traced the perchlorate back to a fireworks launching site that was used on an annual basis. And we found high levels of perchlorate here, and the plume tracked not only to the Davenport building, but also to some private wells in the area, and up to 8 parts per billion. So those people could drink water, had to find alternative sources of water until treatment was put in place. Here to Mass, and here's their public water supply. It was found to have 4 parts per billion. The thing our waste site cleanup crew did was to find out where the fireworks were launched. Here they are in the red, and they're actually downstream from the groundwater flow, so those were not responsible. Then, in looking at what activities happened in the area, the town was just building a DPW garage, and to get through the rock, they used blasting materials that contained perchlorate. The puddles on the site had up to 800, 900 parts per billion of perchlorate, and had some private wells up in this area that also had 800 parts per billion of perchlorate. And those individuals were told not to drink the water. The public water supply was shut off, and other sources of water had to be found until treatment could be put online. So, both in terms of blasting and launching fireworks, in terms of preventing pollution, we put out what's called best management practices. They're on our website that says, you know, don't use blasting agents or fireworks with perchlorate. If you can, do that. If you have to, do not use these things near public water supplies. And we put the Department of Fire Services and the Fire Marshal a lot of information on our website and to get at the local level, again, so we can prevent future contamination of public water supplies. Here's a big incident that happened in Millbury, Mass., which is just outside Worcester. In the testing, we found 22 and 45 parts per billion of perchlorate in the 2 wells that supply Millbury. We shut them down. And site investigation team found the Blackstone River upstream non-detect levels and downstream about 4 parts per billion. And looking further, they found some drainage off a construction site and had as close to 400 parts per billion draining off the site. We found that this mall you see a hilltop. They blasted off the hilltop, and a lot of rocks had undetonated perchlorate adhered to the rocks, and when it rained, it would run off the site and go down into the groundwater and contaminate these wells. So that's another situation. The one that I'll bring up, because it was a big issue, because the Merrimack River is our second greatest water supply in the United States, serving a significant amount of our population. The water supply was found to have 4 parts per billion, and we had to look back. They take their water out of the Merrimack River, and so we had to look back into the river and find out where this was coming from. So we have the intake here to the Tewksbury Public Water Supply. So we first did river monitoring, and we found low levels outside this wastewater treatment plant, and then upstream further, and we got no detects. So then down the Concord River, and it was interesting that we went by one treatment plant and found perchlorate, and then to the next one, and we found up to 800 parts per billion of perchlorate. So then we went through our records, because we keep track of companies that are releasing chemicals into the sewer system, and we found that there was a medical company here, as I mentioned, releasing millions of parts per billion of perchlorate. We told them they had to stop immediately, and within 2 or 3 days, the level in Tewksbury to below 1 part per billion. But we're still left with this, what's going on at the wastewater treatment plants. So our engineers went in and looked through all of the different things that happen, and some of the samples show that there was no perchlorate in the influent to the wastewater treatment plants, but we had high levels in the effluent. So they looked into what chemicals are being applied within the treatment plant, and that's when we found out that hypochlorite used to disinfect drinking water has high levels of perchlorate. And this is what we found. We have different brands, but we found levels as high as 4,000 micrograms per liter or parts per billion of perchlorate in the hypochlorite solutions. So we did more studies on hypochlorite. If you have a fresh solution, it has no perchlorate, but as it ages, more and more perchlorate is generated. So guidance to wastewater treatment plants to only use fresh perchlorate and not buy huge stockpiles that you're going to be using it for 3 or 4 years. And again, this is to prevent contamination. Summary, we had our 9 supplies. We had 3 blasting, and the levels ranged from about 4 parts per billion up to 13 parts per billion in Boxborough. For fireworks, we had slightly more levels, ranging from about 3 to about 9 parts per billion. And with the industry, that caused about 3 way downstream in Tewksbury. And we still have 2 unknown, Hadley and in Southbridge. We have not found the sources after extensive looking. In the fall, we adopted a 2 part per billion standard for perchlorate. Now, why that when we were considering 1? Well, based upon the hypochlorite solution containing low levels of perchlorate, we didn't want disinfecting drinking water to disincentive to protect against microbial disease. We had to balance protecting public health from microbial disease with risk due to perchlorate. You can see here, upon the testing of numerous hypochlorite solutions, many that would result in an exceedance of R1, and that they'd stop to disinfect and we'd have a problem. our department adopted too. So we were the first state in the country to set a drinking water standard for perchlorate. We were the first to find that it's not just military, but other sources. At the time, the EPA was using their 24.5 Party guidance for the cleanups of sites in all the other states. And California adopted in 2007 a drinking water standard of 6 parts per billion, again based on different interpretation of the science. Now this shows you the milestones over the years, health effects on top and milestones on the bottom. Here is where we set our conservative drinking water standard for perchlorate. In 2007, the Centers for Disease Control did a monitoring study on over 2,000 individuals, and they measured perchlorate and iodide in the urine of individuals. And most striking is that they found when women are iodide deficient, which is defined as less than 100 micrograms of iodide per liter of urine, these women had elevated TSH and decreased T4, exactly what we would expect to find in our mode of action. And they also found at the perchlorate levels that these women were being exposed to that you'd need a drinking water standard less than 3 parts per billion, somewhat vindicating the work that we had done. EPA, based on that study, lowered their limit for cleaning up waste sites to 15, but they still made the statement they didn't think it was important to set a national drinking water standard for perchlorate. The EDC study was replicated using different statistical techniques, and they replicated the findings of the first study by Dr. Blount. And then, just recently, in late 2010, an epidemiological study was done in California where they took newborn infants and they divided them into 2 groups if their mother had been drinking perchlorate above 5 micrograms per liter or parts per billion or below. And at birth, they measured TSH in the blood of the infant and found a strong association between levels in drinking water at 5 and above and thyroid hormone effects. Certainly, again, indicating a very low drinking water standard is needed to protect public health. So today is still at 15, but recently, in January of this year, they reversed their decision and they said they are going to be setting a nationwide drinking water standard for perchlorate, and that will take up to a couple of years, but they will be doing that work. I just want to end by saying that when we finished our work on perchlorate, we had learned a lesson that we, as a department, really had to be ready for the next unregulated contaminant coming down the pike. So we turned our perchlorate work group into an emerging contaminant work group, and we set up a protocol to say, what's out there? What are people hearing about? What are people reading about? We really need to start paying attention to. So we pulled together all that information. We also looked at databases where we have environmental monitoring data to see what we were finding in them, and we made a comprehensive list of unregulated chemicals, and then we had a way to prioritize which chemicals that we should take action on. And just a couple of the examples of those that we've been working on since 2007 are pharmaceuticals and personal care products in the environment. They've been often found in drinking water and in wastewater because of human excretion when the dose isn't fully absorbed, or people haven't used medicine and they flush it down the toilet. And, of course, endocrine disrupting compounds people are very concerned about. And another topic that we'll be working on for many years is also nanoparticles. There's a big industrial revolution today with using nanoparticles to do all kinds of work, and it's a total unregulated entity. And we know that these, small particles are capable of doing things that normal particles cannot do in terms of distribution in the body. They cross the blood-brain barrier. They can disrupt DNA. And so we're pursuing our work in that way. With my final slide, I didn't put in the explosive because I was afraid I might blow up the lines. But if you would like more information on perchlorate or emerging contaminants, that's our website. From there. Here is my personal email address if you'd like to talk with me more. And I want to thank you for inviting me here today. And it's a pleasure. Thank you.
Thanks so much, Carol.
You are welcome.
I guess take the questions from online first to see.
Sure. Are there questions online?
We can start maybe. Francis can answer one by one.
Sure. Francesca, you want to go down the list and ask the people one by one?
Sorry, Kristen, say that again. In the office, I couldn't really hear you.
Do you want on the list of people who are online and see if any of them have questions?
Okay. Start with Delita. Delita, any questions that you would like to ask?
Question.
Okay. C, do you have any questions that you would like to ask? Are you still there? I'm trying to take you mute, but I can't.
She might be it on.
Nope, she's gone. Okay. We'll go next to Iman. Do you have any questions? She didn't have. All right, Rita. Do you have any questions?
I don't have questions, but I and my colleagues here at U of M just thought it was a very clear talk and a very worthwhile one to see how the process works. Thank you very much for it. Questions?
Okay, thank you. Nice to know I was clear. Anyway, I was afraid you were going to ask me really hard questions.
Not me.
Thank you.
Is that Francesca?
All right. Up last we have is UPRM. Are there any questions at UPRM?
It's not a question, but I have some comment because in Puerto Rico, probably all 4% of population are not connected to Puerto Rico Water Authority. So those people actually use a lot of Clorox has perchlorate as impurity. So it would be very interesting if we make some conventional perchlorate in Puerto Rico rural community. That's my comment.
I also forgot to mention that some of the research from the biomonitoring studies indicates that up to 36% of the women in the United States have an adequate amount of iodide. And so it's very important to get that message out. Iodized salt, milk, or all sources of iodide can help a woman prevent any effects of thyroid hormone problems on herself or a developing fetus, and actually try to buffer some of the effects of perchlorate.
Questions over here.
Sure.
There are a lot of places, even in the U.S., that they fireworks almost every night. So, is there any standard? Is there any idea that how many times fireworks per year, and we're just exceeding perchlorate standards?
Okay. Yes. Yes. The question was that there are a lot of locations in the United States where fireworks are launched, even on a daily basis. And is there any information to show what relation there is between the frequency of using fireworks and perchlorate contamination? And the answer is no. We tried very hard to get information on perchlorate in fireworks. A lot of fireworks that we buy are from Japan and won't tell us that information. So, I mean, the real issue is to some areas where there's no public water supply, or try to find out if there are some chlorate-free products out there. One of the issues that I found that was very interesting with the fireworks was that, if you talk to the fireworks people, they, oh no, this isn't a problem because the perchlorate's totally detonated. We're like, oh, well, why are we finding it here? And what happens is it's not detonated. And there are housekeeping rules in Massachusetts, for example, that after there's a fireworks launch, sometimes there's paper not destroyed that comes off the firework. We tested that paper, and it had something like 45,000 parts per billion of perchlorate on it. So this time it rained, all that was just going to be going down into the groundwater. So we have been encouraging the cleanup of the firework debris right after a fireworks launch, and that's something that can be done. We have on our website a study that we did around UMass Dartmouth that tried to look at that issue. So I'd say go on our website and look for our fireworks study to measure, the amount of perchlorate after fireworks launching and how much was in the environment. The other thing is that sometimes the fireworks are duds. And so what the companies do is just break them open and pour in them and then throw the rest of the paper material in the trash. That's a house practice that we're putting an end to. Jack.
Just have someone that does not understand what you said. They said that most of the fireworks we use in the United States come from Japan.
Yes, we found that out.
Well, we don't know exactly the Berkeley concept.
Yes.
I mean, can't we just open it in the United States and study the concept of the fireworks?
It would be a very good project to do. Maybe the Department of Defense would have those capabilities. But DP is really, for the most part, applied research. We take all the information that you develop in the laboratories and publish, and we use that in our work, and we have the funds to go out and do that kind of a study. Wish we did, but you're right. Somebody should, through TSCA, EA should be trying to get that kind of information. A question here?
I'm also curious about the influence of NASA and the U.S. Department of Defense on EPA. Do you know how was their influence on treating the standard amount of perchlorate?
Yes. Okay, for people on the phone, what was the influence of NASA and DOD on EPA's work? It was a very strong influence. We hired toxicologists. The toxicologists made presentations showing that 350 parts per billion of perchlorate was protective of public health. They were allowed to speak at the National Research Council meetings. Massachusetts was invited to speak, but he had a road in to the White House directly, and I think that the way to kind of resolve the discrepancy was to bring it outside EPA, which is a shame because that's EPA's charge to those limits, not polluters. And people had concerns about how the NRC panel was selected, and NRC panel was charged with reviewing EPA's work. Well, everybody was astounded when they issued their report, and they came up with a reference dose. there was no one on that committee who had any experience in setting a reference dose. So there was one person who influenced the rest of the committee, and they went beyond their charge and beyond their expertise. 2 physicians in the Boston area were on the NRC committee, and we invited them to come in and talk with us about our interpretation of the data, ask them questions. And for a lot of questions we had, they said, we have no data, it's just our clinical, thinking. And at the end of the meeting, they said, boy, we're glad we live in Massachusetts. And said, oh, you guys are just so, versatile in uncertainty factors. They're in awe that we did this off the top of our tongue, and they didn't know what we were talking about, but yet they were part of a committee that came up with the reference dose, and that led EPA to come up with a very high number that is not protective of public health. So, Obama is in office, things are changing.
One more question. Are there any quick ways to remove that perchlorate, like
Yes.
boil water?
No, it's high soluble, so.
In real temperature, I'm assuming it's oxidizing reagent at high temperature.
Mhm.
I'm wondering.
Yeah.
If it's stable
The
at 100 degrees Celsius.
I don't know that, but the treatment methods that we found to be very effective are activated carbon treatment to reduce the perchlorate, and also ion exchange resins. You pass the perchlorate through the resins, and either you can dispose of them when they're full in an incinerator, and I always picture the incinerator blowing up, but it hasn't happened. Or you can buy resins that can be renewed, so you get chloride off and they can be renewed, and it's a cost savings. And the technology is off the shelf now, and it gets down to non-detect. I mean, we really shouldn't even be arguing 15, 6, 1, 3. It should just be non-detect. So.
Thank you.
Thank you. Thank you.
Great talk. Thank you, Carol.
Thank you.